Well, welcome again to Montgomery Heart Wellness, and we just finished a very, very busy clinic today. And as usual, we see a lot of patients, lots of complex illnesses. As you know, patients fly in from all over the country with a variety of health issues. And so we're going to take the time and share with you some of the clinical problems that we help address today. And we look forward to giving you some insight, and hopefully this will be helpful to you. So stay tuned. Okay, guys, so we're here today in Montgomery Heart Wellness Clinic. And so who has the first patient? We saw a lot of people today. Who do you want to talk about?
Yes, the first patient is Mr. NR. He's one of our outstate patients. He's a gentleman, 43 years old. His medical history includes high blood pressure, which is diagnosed around 4 years ago. And then he mentioned a year and a half later of that diagnosis, he had been told that his kidney function is deteriorating. And over the past 2 years, he had been diagnosed with stage 5 kidney disease. The recommendation from his doctors that he should consider the dialysis and also to look for a donor for kidney transplant.
Interesting.
Yes. So
anything on the physical exam that was telling no abnormalities and murmurs, nothing like that, right?
Yeah.
I remember, having a conversation with him, after you spoke to him. And, his history is interesting, largely because this is a young man who's 43, and about 3.5 to 4 years ago, he felt bad and they've had a headache. His mother checked his blood pressure and it was elevated. So they took him to the emergency room. He was started on, medication, clonidine, and sent to his primary care physician, who just adjusted the dose. So for a period of about a year and a half or two, basically his doctors, they did the basic blood work, echocardiogram, EKG, and all of that was, within normal range, quote unquote, by his report. We haven't seen it. But the interesting thing is that he was just given various medications. His kidney function was normal initially, and then, as you pointed out, a year and a half ago or two, it was found to be stage 3. At that time, he was taking losartan, hydrochlorothiazide, and then I guess he saw a kidney specialist, and now it's progressed to stage 5. What really struck me about that history is that he saw a number of doctors and specialists, and it was just a matter of adjusting medications. I asked him, well, did he put you on a special diet today? Express to you what their thoughts were in terms of your cause of high blood pressure. So the kidney failure could be due to high blood pressure, but it could be due to something else. But there was no discussion of that. And so I want to stress one point. In this situation, there was just an approach to adjust medication. So there was a so-called treatment, if you will. But even though there was a diagnosis of high blood pressure by itself isn't necessarily a diagnosis. It's a manifestation of an underlying problem. The underlying problem is a diagnosis. Now, we may not always pinpoint exactly what that underlying problem is. When we look at high blood pressure, we have what's called essential hypertension. We have secular hypertension. Secular hypertension are a list of somewhat rare or somewhat unusual abnormalities where you can say, okay, this is an abnormality that can cause the blood pressure high, so the blood pressure is secondary to this. However, essential hypertension, we call it essential hypertension because it's usually due to multiple things. And so we don't have one thing we put our finger on necessarily. However, despite that, we should still look and try to gather information on the multiple things that are having an input to high blood pressure and address those things. And the unfortunate thing, he was just given medications just to treat the
high blood
pressure, but not address the underlying problem. For example, dehydration can cause high blood pressure. Magnesium deficiency other metabolic abnormalities can cause high blood pressure. And these things can be addressed and corrected. In fact, dehydration or volume depletion, as some people call it, is very common And by simply hydrating someone, starting them on magnesium, putting them on a healthy diet, the blood pressure can be controlled with fewer medications or without medications. Not only that, these approaches helps the kidneys and other organs. So it's unfortunate medications were just shuffled around, but the problem, the disease process persisted. And now you have a situation with advanced kidney disease. What do we do today as our initial evaluation?
We start with doing some labs and tests for evaluation, and also the nutritional part is very important because the patient is still consuming the regular diet. I forgot to mention that the patient have symptoms of bloating and indigestion. Yes. So
that could be just a GI problem, a microbiome problem, dysbiosis. So that could be a problem that could be contributing to elevated blood pressure. Yeah, and so we'll address that. So there are lots of work to be done with this patient. Now, unfortunately, he's got advanced kidney disease. You don't know if we can turn that around, but we certainly can address these underlying problems and possibly the synergistic effect to get the blood pressure in control, and maybe there could be some recovery possibility of his kidneys. But this, presentation underscores the importance, of understanding that the body is complex and we have to address these problems, from a systemic process, not to start medication. So for the sake of the audience, if you have a loved one or yourself, you may have something like high blood pressure or whatever, don't just, let your doctors just adjust medications. Look at various other things, hydration. Ask about your electrolytes, micronutrients, magnesium. Ask about, gut health, those types of things. These things are important in terms of your total body health, and these things oftentimes need to be addressed. When you look at something that seems to be as simple as hypertension, 1 or 2 meds, get the blood pressure in control, and you're good, not necessarily, because the underlying problem is not being addressed. So I look forward to seeing how he turns around, and we'll keep posted. Who's next?
We have a patient named J.M. She's 57, has a history of left-sided breast cancer that was treated in 2021 with a lumpectomy, removal of a lymph node, chemotherapy, and radiation. And then just recently this January, she had gone to the emergency room for neck pain, and they found a lymph node in the neck. So that was new, and she came here wanting to really get her health in line and figure out what she should do nutritionally to support her own immune system. So we did get started into some of the discussion of the things we would recommend. But one of the big things is the micronutrient test to see what her personal intracellular deficiencies are and which antioxidants will actually work the best and help her body heal. Because we know a lot of the big anti-cancer agents, broccoli sprouts, vitamin C, curcumin, and this would allow us to be even more specific for her. She was really interested in the ozone therapy as well, which helps modulate our immune system to fight off disease and heal the body, so shift to more cell repair rather than negative cell changes or cell death. And do the detoxing, of course. She had already started trying to eat healthier, but, we needed to fine-tune that.
Wow. So very interesting clinical presentation. So here's one patient who had, I guess you would call her a breast cancer survivor. So she had the surgery. I do remember she has lymphedema on the left arm.
Yes.
And she told me after they started an IV in an emergency room, immediately after that, she had lymphedema. Now, she does not recall being told not to have a needle stick. So for those of you out there who've had breast cancer, surgery on the side, no needle sticks or blood pressure measurements on the same side of your cancer surgery. She normally they are told that, and she wasn't informed that. So that's something we're going to look into with some vascular studies and the like. The interesting aspect of her story is that she's a breast cancer survivor, but now there's some small little things coming with the thyroid. What people have to understand is that once you've survived cancer, it's not necessarily totally gone. Those cancer cells may live dormant in different parts of the body, so you want to be vigilant in optimizing your health. So you may have had the surgery, you may have had the radiation, chemo, you may be in remission, whatever the case is, but that's time for now to optimize your health, nutrition, and various other approaches that you mentioned, such as anti-inflammatory, immune boosting, supplements. We've been pretty aggressive with her, given the issue with the arm. We're going to add some serrapeptase to her regimen to decrease inflammation, and not natural kinase. She can have microscopic blood clots. We'll do an ultrasound, make sure it's not a vascular bruising of that arm. So these are the things that we're going to work with her on. But the key part here is you have a breast cancer survivor, but you have to be vigilant with going on. Now, she had a number of other issues. She lost her son tragically earlier that year, so there was some emotional stress, which can also have an adverse effect on the immune system. And so she was going through that. She also had mold in her house. And so that's why she had to go to the emergency room, get an IV. That's why they stuck her. That's stressful. So, oftentimes life gets in the way, and we have to be mindful of these things. And so we work with our patients, being mindful of these issues that are going on. We address it on a clinical standpoint. We give them recommendations on how to cope. She's coping with her son's death reasonably well by her account. The issue with the mold is being addressed. Her mood is up, and so she's ready to move to the next level. So these are all the things that you want to be mindful of. And even though you can't control life events, be mindful of the potential impact they can have on your life and your health, and try to address it. So, for example, if you have a busy work schedule, you have a stressful issue with a loved one, you can optimize your diet as best you can and make up for it in some other areas until you're able to get over these areas. So I think this is very, very important, but I look forward to seeing her outcome as we move forward.
Our next patient is also outstate patient. He is 66 years old gentleman. His name is like Mr. MP. So his medical history in the recent years diagnosed with salivary gland stones. And also he mentioned that he have some dental problems and sleep apnea. Patient mentioned that last year he went to the emergency room for back pain, and he had been told that he has abnormal rhythm in the EKG. They repeated, diagnosed as atrial fibrillation. Also, it had been repeated again, the EKG, months later, and it showed the same thing, atrial fibrillation. The patient was prescribed a blood thinner, but he would like to seek another approach to treat what, like, is it atrial fibrillation, is it not, and if there is anything can be done to avoid the medication, like the blood thinners. And
so I think it was Pradaxa. They put him on the anticoagulant Pradaxa, and he read the side effect. He was concerned.
yes,
His story is interesting because his atrial fibrillation, he's in persistent atrial fibrillation. So he wears his watch, and he's always in AFib. He says, the only time I'm not in AFib is when I'm not wearing a watch. So a 66-year-old man with atrial fibrillation, a number of other problems, parotid gland issues, back pain. He's pretty tall. The question becomes, how do you manage this patient? Anticoagulation is part of the management for atrial fibrillation. He and his wife are a very charming couple. I enjoyed visiting with them. They walk, they exercise. They got married in their 50s. They both have children from other relationships. They've come together. It's interesting because, she's a breast cancer survivor. And I think he told her, he said, look, we have a 50-year contract, so we've got to do this together. So they went on an aggressive, healthy lifestyle program. They walked 3 to 5 miles a day. One day they walked 24 miles, 12 miles each way. They exercised together. She actually is a vegan chef. I think had a business and makes these beautiful, delicious plant-based meals, and saw some of our videos, made some adjustments in him. So, he has that benefit. So he has a relatively healthy lifestyle. Now, you try to understand, when did the atrial fibrillation start? he doesn't know exactly, but he tells me in 2023, he was looking at some video talking about mindfulness and appreciation. And so the video said, put your hand on your heart and appreciate your heart beating. So he put his hand on his heart, couldn't feel his heart beating, so didn't feel a heartbeat. And he still doesn't feel it beating. Now, that's probably due to the atrial fibrillation. And so he probably had it at least that time, maybe before. Now, the other thing, this may be a little controversial, I mentioned, they had the coronavirus vaccine.
Yeah.
And they had 2 boosters, and they still caught the coronavirus infection multiple times after. And we know the vaccine can trigger inflammation. Infection can trigger inflammation. So the atrial fibrillation may be a sequelae of that, because his lifestyle is reasonably healthy. He's a nice, thin person that exercises. So that's one thing to keep in mind in terms of the potential underlying causes. So the question becomes, what do we do now? He's in persistent atrial fibrillation. And the issues with atrial fibrillation, number 1 would be symptoms, rapid heartbeats, shortness of breath, discomfort. He does not have that. Number 2, the risk of stroke. His risk of stroke is kind of borderline. He's 66, so he gets 1 point for being over 65. And he had an echocardiogram that showed an ejection fraction of 45%. Kind of in the gray zone. Some people may read normal one day, abnormal the other day. So he had at least 1 point on the CHA2DS2-VASc score, maybe 1.5 or 2 at most. So then maybe that pushes you toward anticoagulation. The fact that in persistent AFib may push you more in that direction. And then the other third potential problem is chronic atrial fibrillation can progress to heart failure. So abnormal remodeling. An ejection fraction of 45% suggests that there may be some early adverse remodeling. So given those things, no symptom, but possible early adverse remodeling, borderline abnormal CHA2DS2-VASc score, we can lean toward anticoagulating him now. But I would want to work to get him out of atrial fibrillation and keep him out of atrial fibrillation and reverse the abnormal remodeling to maybe help the heart get stronger. So the approach could be multifold. What we like to do, look at micronutrients, look at the gut, see if they're abnormal microbiome, start him on a healthy diet. He's been eating very healthy and made some changes. We can tweak it a little bit. In 4 weeks, when we get those results back, we'll make a decision as to whether to do a gut cleansing protocol. And then we'll decide whether to start him on an antiarrhythmic drug, amiodarone, and go for a cardioversion to get him out. Now, amiodarone is a medication. If you look it up, there's a lot of side effects. The reason I like using it is probably the best drug for atrial fibrillation. I like to use it for a short period of time to help the heart get under control. So when you cardiovert, you have to start to stay out of atrial fibrillation. That plus the nutritional regimen, if there are micronutrients that need to be replaced, will address all those things simultaneously. So that approach will be taken with him. We follow up. We'll make a decision on the amiodarone and other things as well. And so he's got a very interesting clinical scenario because there's some complex things and a number of different options. They were asking about atrial fibrillation ablation. Atrial fibrillation ablation does have its place. In his situation, I'm not certain I want to jump to that immediately. I think there's some other work to be done to look at his systemic biochemistry and physiology and see if we can correct that first. It may be part of the regimen later on, but I think with him, we can probably do this out of it. And then there are other things such as natural kinase, which there's some data suggests it may stabilize the spike protein. So if he received the coronavirus vaccine, he may be reproducing spike protein, which may be triggering more inflammation. So we went ahead and started him on natural kinase as well as some other anti-inflammatory supplements. So we'll see him, follow him by phone, see how he does, and then see where we go. So again, not so straightforward, but the number of options we have, I feel fairly confident we could probably get this condition.
And I think because the patient is not symptomatic, that's why he feel like I may not have anything or may not need like medication because he's not feeling the symptoms that regularly the patient feel, the palpitation and other things.
Yes. And as you pointed out and you discussed with me earlier, his height, there's some other connective tissue issues suggestive. So at some time, calling you may do a CT of the chest to make sure there's no ear issue with the consideration of Marfan's syndrome. So we'll keep that in mind too. Great scenario. So again, it's the thought process. It's you want to look at things, go below the surface and understand how the patient is doing from a biochemical standpoint and a physiological standpoint and address those issues. Great case. We have one more?
Yes. This lady, her name is JP. So she's 78. She came here with history of hypertension, hypothyroidism, and diabetes, and her son had noticed in her that she was having more breathing problems when they'd walk around together, even in the home, like going up the stairs. She'd have to take a break sometime. It wasn't like it used to be, and so he had encouraged her to come here. He's a vegan already, plant-based, and she was attributing her lower energy level to maybe her thyroid condition, but we know that that's a very common symptom of artery disease in the heart, and she had not had a heart workup yet. So 78-year-old woman with diabetes, hypertension, high cholesterol, I mean 100% has some form of heart disease. So she really got on the detox and started that. Mostly a lot of salads and veggies, and we immediately stopped one of her diabetes medications to prevent hypoglycemia. And even at 2 weeks, she was going up the stair without feeling out of breath anymore. And she used to have really bad headaches with her high blood pressure, and those went away. Now, the blood pressure still wasn't exactly where we need it to be, but it was getting better. So I ordered a perfusion study called the PET scan of the heart to really assess her perfusion better. And talked with her about some other things again that at first, she was a little hesitant to start. That we offer like the infrared light therapy to lower blood pressure, improve dilation of our blood vessels. I also talked with her about the ECP therapy. We might, look at her PET scan, but ECP improves collateral blood flow and really improves symptoms in coronary artery disease.
Yeah, and it's interesting how in a very short period of time, just with an aggressive nutritional intervention, she had, immediate symptom relief. I think these other recommendations are appropriate because it takes her to the next step. Someone in her situation could have very complex underlying health issues and not know it, and the symptoms, just fatigue, may seem to be mild on the surface, but they can be due to some advanced illnesses such as advanced heart disease and other things that could be causing a problem. But just by simply making a major nutritional change, you can start to halt the process in its tracks and start to turn things around. And at the same time, you're getting other diagnostic tests and recommending other more advanced therapies. So again, getting to the underlying problem is always the key. And it's not just a matter of, coming up with a cookbook set of meditations that on some macro guidelines list, but it's really talking to the patient, understanding what's happening with the patient at the biochemical and physiological level, and addressing those problems there. So a great situation, and I'm very, very encouraged about her initial improvement. I look forward to her having a much better outcome. So there you have it. I hope we gave you a sample of the patient we saw today. We saw lots of other patients, other issues, and we'll continue to bring these cases to you and explain our thought process in hopes of giving you insight in terms of how these chronic illnesses can be addressed. If you have one of these chronic illnesses or something similar to them, and you're seeing a physician, make sure they're taking a similar approach and not just giving you a medication or recommending a procedure without trying to understand the underlying process, and always ask questions in terms of what they think may be going on. If you're not satisfied with the answer, maybe you should ask someone else. So I hope this was helpful as usual. If you have any questions or comments, place them in the comment section. And until next time, take care. Thanks for watching. If you got value out of this video, Please like it, subscribe, and hit the notification button to see our next